This is week number 3, lecture number 5. In this lecture, I am going to talk about various psychological distress scale. This lecture has been prepared by Dr. Yashwant Joshi and I am the presenter, Dr. Geeta Joshi. In palliative care setup, many of our patients has psychological distress, and it is very necessary to measure how much the distress is, what is the level of this distress, so that we can intervene at right moment before the things go out of our hands. There are few very famous psychological distress scales are in practice, and we are going to discuss about it. The Kessler psychological distress scale, normally called K10 because it has got 10 questionnaires. It is designed to measure the anxiety and depression through 10 item questionnaires, and each question pertains to an emotional state and each has a 5 level response scale. The instrument uses a patient self reporting, patient does it self reporting, and instrument can be self administered or interviewer administer, and patient's privacy should be taken into the account, and you should ensure that whenever you are questioning the patient with all these questions, the patient should be given enough privacy. Sometimes patient is not able to express their emotions or distress in presence of other people. This K10 was originally developed in United States for the substance abuse people. They wanted to know that what is the level of mental illness among these drug abusers, and that is how it came into the practice. The psychometric properties of K10 are discussed in Kessler, Becker-Kolb's, this one of the research article. It has described this, how effective this scale is. You can refer this on the web link. So, this Kessler psychological distress scale is a simple measure of psychological distress. It has got a scale which involves 10 questions. The questions are related to emotional state and each with a 5 level of response scale. The measure can be used as a brief screen to identify levels of distress. So, briefly you can identify whether patient has distress or not and what level of distress patient has. The tool can be given to patients to complete, or alternatively questions can be read to the patient by a practitioner. In the context of injury management, the measure can be provided to the patient where recovery is not proceeding as anticipated. See, suppose your patient is not recovering well, then you should try to evaluate its distress or emotional distress by using this K10 scale. And many highlight the need for more regular review or referral to the specialist health providers such as psychologists. By using this scale, you can judge the level of the distress and you can refer the patient to psychologist or psychiatrist. Question 3 and 6 are not to be asked if the previous question shows that none of the time. So, they are almost interlinked and you can eliminate these two questions. In such cases, question 3 and 6 should receive an automatic score of 1. This is the scale showing questions on left hand side. On right hand side, the level of measure, that is all of the time, that score is 5, and then the score reduces on the towards the number 1 where the score is 1. So, all of the time, most of the time, some of the time, a little of the time and none of the time. And here the question starts with number 1 question. Here they evaluate the psychological state of previous 4 weeks of the patient's life. In the past 4 weeks, about how often did you feel tired out for no good reason, just without any reason you feel you are tired out, you do not feel like doing anything. In the past 4 weeks, about how often did you feel nervous? In the past 4, if previous 2 question has score 1, then no need to ask question 3. In the past 4 weeks, how often did you feel so nervous that nothing could calm you down? Number 4 question is how often did you feel hopeless? Number 5 question is how often did you feel restless and fidgety? Number 6 question is how often did you feel so restless that you could not sit still? Sometimes patient becomes restless and just moving around, cannot sit at one place. In the past 7 number, in the past 4 weeks, how often did you feel depressed? Question 8, how often did you feel everything was not worth an effort? Number 9 ask about how often did you feel so sad that nothing could cheer you up. And number 10, how often in last 4 weeks, how often did you feel worthless? So, these are the question and you can have a score against each question and how to interpret. Each item is scored from none of the time to number 5 all of the time. So, score of the 10 items are then sum up and minimum score is 10 and maximum will be 50. The low score indicates low level of psychological distress and high score indicates higher level of psychological distress, which will require intervention or psychologist reference or psychiatrist reference. In 2001, Victorian Population Health Survey adopted a set of cutoff score that may be used as a guide for screening for psychological distress, and these are given below. If on K10 scale, if your score is 10 to 19, you are likely to be a well person, good, okay person. If the score is 20 to 24, you are having a mild psychological disorder. 25 to 29 score is likely to have a moderate disorder, and 30 to 50 likely score, the person is likely to have severe disorder. These are the references you can check and have more information from these articles. Coming to primary use of this K10 scale, it is a 6 item inventory rated. They have devised another scale which is K6. In that previous scale it was 10 questionnaire, here it is K6, 6 items are inventory and rated on the 5-point Likert type scale. It is truncated version of the K10, it is a smaller version of the K10 and its purpose is also to function as a global measure of distress, drawing from depressive and anxiety related symptomatology. It measures distress over a period of 4 weeks prior, similar to K10. Here also you are evaluating the status of the patient 4 weeks prior the administering this scale. The K6 contains several additional questions. However, These are supplementary and are not required for scoring of scale. Some supplementary questions are also added so that you can get proper meaning of the question which are there in the K6 scale. Coming to another thermometer, it is called thermometer like a temperature thermometer. Here it is a distress thermometer. It is a very simple and very effective device. Is used in hospital ward where the patients are admitted and where it can be evaluated every day by a nurse or a paramedical staff. Particularly patients with cancer and their families and carers may experience a range of psychological symptoms. See, start right from the diagnosis up to the treatment and recovery of the patient. There are number of stages through which patient and family pass through during the disease trajectory, and they are likely to have distress like hearing the diagnosis, hearing the stage of the patient disease, hearing ineffectiveness of the chemotherapy, hearing about the recurrence of the disease, hearing about the development of metastasis of the disease, primary cancer. So, all such stages patient is likely to have distress and even family. And this distress thermometer is a tool to be used to measure patient's level of distress, and it has been found that it was useful in screening patient. This is a screening tool and to identify the patient who needs help, means they want psychosocial intervention, they need proper communication and counseling by a trained nurse or physician or psychologist. This is the reference of this distress thermometer. You can go through it. Why distress thermometer? It is a quick screening method tool involving fewer than 5 questions and have been recommended as a simple method of detecting distress, anxiety or depression in several different types of cancer setting. This has been used extensively in cancer setting and there are few questions in it. The National Comprehensive Cancer Network in US developed the distress thermometer in 1998 and which has been widely used for people with cancer, and results of the research and evaluation show that people who score 4 or below are considered to have expected distress symptoms. So, the score 4 or below is okay, normal, which is expected level of distress and need simple intervention, but the people who score more than 4 should be referred to psychologist or psychiatrist for a further intervention and counseling. People like the thermometer because it is easy to use. The very practical aspect is it is easy to use, it can be used by patient, patient's relative, paramedical staff or volunteer, anybody. It generally takes about 20 seconds to give answer to the questions given in it, and it carers reported that it helped them focus on their true concern. The each and every problem areas are written in that. So, patient and carer can identify exactly which area they are talking about. Patients are asked to consider their level of distress over last week. It is not very prior up to 4 weeks where patient may not remember also, but only very short duration previous week, how they feel about various situation, that is what is asked in the distress thermometer, and we will see it in next slide. So, this is the distress thermometer where the scale is from 0 means no distress, and 10, the highest score is 10, which means extreme distress. On right hand side, problem areas are listed down. Like practical problem, you have to list yes or no. Against each problem, you have to write yes or no, like practical problems like housing problem, insurance problem, work and school problem, transportation problem, child care problem. These are the routine problem a patient or carer will face. Similarly, family related problem, problem with the spouse or problem with the children or problem with the parents, something like that. Then emotional problems, too much of worries, too much of sadness, depression, nervousness. Similarly, spiritual concerns, angry with the God, loss of faith and other problem. Then it does not evaluate only psychological aspect, it evaluates the physical problems also. Here there is a list of symptoms which patient has to tick and say yes or no, as well as they have to write the score, 4 number or 3 number or 2 number or 8 number, like that. So, by this, just having a look at it, patient's attending physician will come to know that this patient has got this many physical problem, this many symptoms, and these are the areas where he has a psychosocial problem. So, this area will be picked up by the psychologist or social worker, and they will start their action on it by counseling of the patient, talking to patient, and with good communication with the patient and carer. The list of physical problem are almost every list, every problem has been, symptom has been listed down, like pain, nausea, fatigue, sleep, that is insomnia, mouth sore. These are the common symptoms you will find in a cancer patient. So, distress thermometer is a very effective tool, very practical, easy to use, and it has advantage that it describes the physical problem as well as psychosocial problem, which is faced by cancer patients on day to day life. So, learn these two tools, put them in practice. You can use any of it in your practice and make it a habit that your each and every team member of your team should learn this to use this thermometer and make documentation as every day. This will help your patient, identify your patient, and help them in psychological intervention. Thank you very much.